I'm happy to provide you with a detailed guide on how to get rid of a sinus infection and prevent sinus headaches. Sinus infections, also known as sinusitis, can be uncomfortable and bothersome, but with the right approach, you can alleviate symptoms and reduce the risk of future episodes. This comprehensive guide will cover the following topics: understanding sinus infections, common causes and symptoms, home remedies for sinus infections, medical treatments, preventing sinus infections and headaches. 1. Understanding sinus infections. Sinus infections occur when the sinuses, which are air-filled cavities in your skull, become inflamed and infected. There are several types of sinusitis. Acute sinusitis. This typically lasts for a few weeks and is often caused by a bacterial infection. Chronic sinusitis. This lasts for more than 12 weeks and may be caused by bacterial or fungal infections or other factors. Subacute sinusitis. This falls between acute and chronic sinusitis, lasting between 4 to 12 weeks. Recurrent sinusitis. When you have several episodes of acute sinusitis within a year. 2. Common causes and symptoms. Causes: bacterial, viral, or fungal infections. Allergies triggering inflammation. Nasal polyps or a deviated septum. Environmental irritants like smoke or pollutants. Symptoms: facial pain or pressure. Nasal congestion. Thick yellow or green nasal discharge. Coughing. Fatigue. Fever. 3. Home remedies for sinus infections. If you have a mild sinus infection, you can try these home remedies to alleviate symptoms. 8. Saline nasal irrigation. Use a saline solution, a mixture of salt and water, to flush out mucus and irritants from your nasal passages. You can use a neti pot or a saline nasal spray for this purpose. B. Steam inhalation. Inhaling steam can help relieve congestion and ease sinus pressure. Boil water, pour it into a bowl, and inhale the steam while covering your head with a towel. C. Warm compress. Apply a warm compress to your face to reduce facial pain and pressure. You can use a warm, damp cloth or a microwavable heat pad. D. Hydration. Drink plenty of water to keep your mucus thin and easier to expel. Avoid alcohol and caffeine, as they can dehydrate you. E. Rest. Give your body time to heal by getting plenty of rest and sleep. F. Humidifier. Use a humidifier in your bedroom to maintain moisture in the air, which can ease congestion. G. Avoid irritants. Stay away from smoke, pollutants, and allergens that can worsen your symptoms. H. Elevate your head. Elevating your head while sleeping can help drain mucus from your sinuses. 4. Medical treatments. If your sinus infection is severe or persists, you may need medical intervention. Consult a healthcare provider for the following treatments. A. Antibiotics. If your sinusitis is bacterial in nature, antibiotics may be prescribed. Finish the entire course, even if symptoms improve. B. Decongestants. Over-the-counter or prescription decongestants can help reduce nasal congestion. Be cautious with prolonged use, as it can lead to rebound congestion. C. Steroid nasal sprays. These can reduce inflammation in the nasal passages and relieve symptoms. D. Pain relievers. Over-the-counter pain relievers like ibuprofen or acetaminophen can alleviate pain and fever. E. Allergy medications. If allergies contribute to your sinus issues, antihistamines or allergy shots may be recommended. F. Sinus surgery. In severe or chronic cases, surgery may be necessary to remove nasal polyps, correct a deviated septum, or improve drainage. 5. Preventing sinus infections and headaches. Preventing sinus infections and the associated headaches involves lifestyle changes and strategies to reduce your susceptibility. Here are some tips. A. Maintain good hygiene. Wash your hands regularly to prevent the spread of viruses and bacteria. Avoid close contact with sick individuals. B. Manage allergies. Identify and manage allergens that trigger sinus symptoms. Use air purifiers and keep windows closed during high pollen seasons. C. Stay hydrated. Drink enough water to keep your mucous membranes moist. D. Avoid smoking and irritants. If you smoke, consider quitting, and avoid secondhand smoke. Stay away from environmental irritants and pollutants. E. Humidify your home. Use a humidifier to maintain indoor humidity levels between 30 to 50%. F. Use a nasal rinse. Consider regular saline nasal irrigation to keep your nasal passages clear. G. Practice good sinus health habits. Avoid excessive use of nasal sprays, as they can worsen congestion. Treat underlying conditions like allergies and asthma. H. Maintain a healthy diet. Consume a balanced diet rich in vitamins and minerals that support your immune system. I. Exercise regularly. Physical activity can improve circulation and immune function. J. Reduce stress. Chronic stress can weaken your immune system. Practice relaxation techniques such as meditation or yoga. K. Get vaccinated. Influenza and pneumonia vaccines can reduce your risk of respiratory infections. Remember that it's essential to consult a healthcare professional for a proper diagnosis and treatment plan if you suspect a sinus infection. Follow their advice closely, and if your symptoms worsen or do not improve with home care, seek medical attention promptly. In summary, sinus infections and the associated headaches can be managed and prevented through a combination of home remedies, medical treatments, and lifestyle changes. By taking proactive steps to maintain sinus health and seek appropriate care when needed, you can reduce the impact of sinus infections on your overall well-being.